We're going to be cutting the pulmonary artery into the right ventricle, parallel to the groove of the coronary artery.
Do we have to cut and then here? This way?
Parallel to here.
Okay.
Or from here.
This area right here, correct?
Yeah.
Just deep enough to go through the wall.
Yeah.
What?
Just deep enough to go through the wall behind.
That's what happened.
So,
Yeah, I guess like that.
okay. Keep going. Okay.
Locate the right atria.
The right atrium's back here.
So this is the external of the heart, and here we have the aorta. So this brings blood up to the head, away from the heart. Then here we have the pulmonary artery. So it goes over here. On this side we have the superior and inferior vena cavas. So this is the superior part, this is the inferior part. And then here we have the pulmonary veins.
This is the interventricular septum of the heart. It's a wall-like divider between the right and left chambers of the heart, and because it is a physical barrier between the two chambers, it prevents the mixing of deoxygenated blood and oxygenated blood. This area here is the left atria, which is the upper left chamber of the heart. It's in an area where it can receive oxygenated blood from the lungs, and it's also superior to the left ventricle, which would be the next area the blood would be circulated to. Here is the left ventricle, which is the lower left chamber of the heart. It is inferior to the left atria, and it also receives oxygenated blood from the left atria. The walls of the left ventricle are thicker than the walls of the right ventricle, which allows for more pressure inside the left ventricle, and this pressure is necessary when the blood is being pushed out to the rest of the body. Shown here is the tricuspid valve, which is located between the right atria and the right ventricle. Because it is located here, it separates these two chambers and also regulates the flow between these two chambers. The tricuspid valve is a one-way passageway for the blood to flow from the right atria into the right ventricle. As the right ventricle contracts, the tricuspid valve closes, which prevents the backflow of blood from the right ventricle back into the right atrium. This valve also has tiny cords that are attached to the walls of the right ventricle, which support the little leaflets that make up the valve. This is the pulmonary valve, which is located between the right ventricle and the pulmonary artery. This allows for the valve to control the blood flow from the right ventricle into the pulmonary artery, and also prevent the backflow of blood from the pulmonary artery into the right ventricle. It is shaped with 3 leaflets, which open when the ventricle contracts to allow deoxygenated blood to flow to the lungs, and it closes to prevent blood flow back into the heart when the ventricle relaxes. Here is the superior vena cava, which is located outside of the heart, where it can direct and bring deoxygenated blood from the rest of the body into the right atrium of the heart, which then begins the circulation of the blood through the heart to be reoxygenized. To expand upon the circulation of blood through the heart, the superior and inferior vena cavas bring blood from the rest of the body into the right atrium. From there, the blood is pushed through the tricuspid valve into the right ventricle, which then the blood flows to the pulmonary artery by passing through the pulmonary valve, The pulmonary artery leads the blood to the lungs where it's then oxygenated, and from the lungs the oxygenated blood goes into the left atrium where it re-enters the heart, and then pushed through the mitral valve which leads to the left ventricle. From the left ventricle the blood goes into the aorta, and the aorta brings the blood to the rest of the body once again.